Welcome again to the next session of today at Pharmacircuit. So we are happy to have here Ajit Singh. He is the National Director for Research at the World Youth Heart Federation. He's the Vice President of Medical at INDICA, and at the same time he is CEO and co-founder of CleanMed Research Solutions. He has a very vast experience in the Department of Medicine at the KMC in Manipal, and as a principal investigator at the Heart Failure Registry in Manipal, and also at the Kasturba Medical College and Hospital. At the same time, he is a member of the American College of Cardiology, the European Society of Cardiology, and the International Society for Pharmacoeconomics and Outcome Research. So as he's also a speaker and novelist, we are very well looking forward to hear what he has to share today with us. So Ajit, the stage is yours. We're looking forward to your presentation.
Thank you very much. And first of all, I am very thankful to Pharmacircuit and all of you guys to invite me at this platform and this topic. And the theme of your conference is really amazing. So good evening, everyone from India. This is 7:45 p.m. in India right now. So I think let's start with the topic because we have 30 minutes and this topic is really vast. So today I'm going to speak on pharmacy education system, time to challenge. So I hope I'm visible and audible clearly.
Yes, you're completely audible and visible.
Thank you for the nice introduction. So yes, I'm working as at these positions right now. So let's start with the pharmacy education and current profiles of courses. So actually, pharmacy college is the primary setting where all the students could and should take advantage of the opportunities and these opportunities to develop their personal and professional attributes. It is also the place that will assist students in shaping their future as a healthcare professional. So pharmacists should acquire these competencies when they're in the college. Like they should understand how to provide the patient-centric care and how to work in the interprofessional teams and how to employ the evidence-based practices. And again, in this quality improvement is very much important. So they should understand how to improve the quality of the product. And now as the era is going towards the technology, so they must understand the uses of informatics as well, right? So as we know, traditionally, pharmacy is the course which deals with the preparations and dispensing of the drugs. It involves many subjects at the basic entry level, to understand the drugs and their effect and the living articles. So in India and in abroad as well, in different countries, there are different courses which has been introduced at the entry level, at the masters, at for the doctorates, and there are many things like you can see at the screen. In India, we start in three forms actually. First we can start with the diploma in pharmacy, which is 2 years entry level course. After higher secondary school, again after higher secondary school, students go for 4 years entry level course, which is called as Bachelor of Pharmacy. So this is a bachelor degree, and now we have a new course since 2008 that is called Doctor of Pharmacy. Of course, in USA and in a few more countries, that is very ancient, I will say, because in US, University of Southern California had started Doctor of Pharmacy in 1950. But in India, we got it in 2008 for the first time. So that is again one of the entry-level pharmacy course in India, Doctor of Pharmacy, which has the duration of 6 years. 6 years, and that 5 years are totally dedicated to the studies and clerkships and other things. I'll discuss this again in the upcoming slides. But after these three courses, you can go for either masters or PhDs or further higher educations if you want. Like we have masters in pharmacy in India. We have MBAs, master in business administration, in different streams of like pharmacy management, marketing, and other more. And we have masters in technology as well, in biopharmaceutics and drug developments. And then we can go for PhD. But in the contrast, in US, Australia, Canada, and other places, we have very limited number of courses, or we can say the titles of courses, like a BS, Bachelor of Science, Doctor of Pharmacy for the entry level, and then Master of Science, MS, and then PhDs, right? And if you look at the things, things here, number of colleges and pharmacies, number of pharmacy schools or colleges all over the world, that is really eye opener for everyone. When I was seeing these statuses, this status is recently 2021. So USA has only 143 plus 2 pharmacy courses, like 143 proper pharmacy colleges, pharmacy schools, and 2 pre-entry level pharmacy colleges. Germany has only 8 universities where they provide pharmacy courses, entry level, masters, and PhDs. Australia has 28 only. Canada has 26. But in India, you can see the number; it is exponential. It is like 2,740 pharmacy schools in India. That is really a big number, and you can understand when there is a big number of schools, how many of the students will come out every year, and what would the status of their employment, their skill development, their many challenges would be definitely there, right? So in India, actually, formal pharmacy education is leading to a degree begin with the, as I told, 3 years of Bachelor of Pharmacy. And in India, it was started in 1937. At that time, the curriculum was presented as a combination of many subjects, like pharmaceutical chemistry, analytical chemistry, and pharmacy practice, which was prepared graduates to work as a specialties in quality control and standardization of the drugs for pharmaceutical companies, but not exactly for the hospitals or clinical settings. So before India gained independence in 1947, there were only 3 institutions which were offering pharmacy degree programs. You can see here, we got independence in 1947. So before that, there were 3 colleges, but right now we have 2,750 colleges all over India, right? And this Doctor of Pharmacy course, as I was telling, this is introduced in USA for the first time by University of Southern California, the School of Pharmacy, and they are still pioneer in this innovative education and preparations. But in India, it came very recently in 2008 in some of the private universities. But in last one decade, they have come up with several colleges, several 250 plus colleges for PharmD degree in India. Currently, there are 250 plus colleges. So what I was talking is, we are going to talk about the challenges and how it is impacting the syllabus. I'll start it with the my case itself, or if I say my colleagues, my juniors, because I was the second batch in India. So how we found it difficult. I was in India's one of the top most what we say the top-notch college, Manipal College of Pharmacy, and this has all the worldwide facilities, all the world-class facilities at campus to provide to the students. But still, we used to always face that problem, like we did not have the faculties who belongs to actually the theme of clinical pharmacy. We had faculties from those pharmacy practice, masters of pharmacy practice, but as master of pharmacy practice, and these are totally different and they have different curriculums. Of course, it's matching somewhere, but not that great, because clinical pharmacy is totally leading to the patient's care, pharmaceutical care, pharmacovigilance, and drug doses calculations, and drug error findings, and drug related problems findings, and many things are there. It totally dedicated to the pharmaceutical care. But uh, somewhere we were missing that, and I think still we are missing, because that this is very recent course, and the implementation was uh, quite complicated in India for the PharmDs, right? So as you can see here, the curriculum of PharmD, if I say, this is the 6-year curriculum. Uh, in first, second, and third years, and in fourth year, we just read the theory subjects, kind of human anatomy, physiology, pathophysiology, therapeutics, and all, right? But if you look at the and sixth year, fifth year and sixth year is totally dedicated to the clerkship. If you can see the screen, clerkship means they I hope all pharmacy people here are understanding that we have to go to the hospital for 6 months. We have to go through the patient's counseling. We have to go through the patient's records. We have to understand the lab investigations. We have to understand the drugs. We have to understand the side effects. We have to understand the adverse reactions. We have to understand the drug interactions in this clerkship. This is totally dedicated to that, but it is missing. It is really missing in some colleges which are really focusing on the quality education. Definitely they're providing somehow and somewhat, but not exactly what is expected. It's not exactly what is expected from all the colleges and all. I'll give you one example here again, because I'm now in the pharmacy education, and I'm running a full-fledged clinical research solutions pharmacy education wing, where we are teaching a lots of students in different courses. We are providing them skill development courses. We are providing them hands-on training courses in pharmacovigilance and all. So I was talking to one of my student recently. She has uh, she passed from the from her PharmD course 1.5 year back, and she joined one of the reputed hospital. One day, very recently, one day I was talking to her. I was just asking the feedback. How are you feeling in this job? She's working as a clinical pharmacist, because that is the I think most common job and most appropriate job after PharmD, or after this. Actually, for the pharmacy care, pharmaceutical care, that is the most appropriate job for the people, for the students after their entry level courses like PharmDs, or maybe BPharm or BSc, Bachelor of Science Pharmacy Practice. So she was just telling me, sir, I'm very frustrated and I really don't want to pursue this job, or I don't want to continue this job. I just asked why you don't want to continue this job. Here you have to understand the challenge. Here you have to understand that why we need to challenge this, current curriculum or current scenario, or current implementations of regulations, and the things. Why we need to challenge the pharmacy education right now. So just telling, sir, I'm not satisfied because I'm not getting that exposure in this hospital. I asked, what is the exposure you want? She was telling, sir, in whole entire first year, I spent in the pharmacy. Being a PharmD graduate, I did 6 years. I did internship and I did everything. After that, hospital is not allowing me to interact with the patient. They are just they're just sending her to the pharmacy and allowing her just to dispense the drugs. So of course she will be coming to the saturation point, because she's not getting what she meant to be trained. Actually, she meant to be trained during the course. you know so I was asking, what was the reason? What could be the reason? Why? What do you feel like? Why they're not allowing you to go to the patients, and why they're not allowing you to interact with the patient? She was telling, sir, they don't feel that we are competent. The hospital people, of course, I mean, this is something really damaging, but yes, this is the truth. They sometimes don't feel that we are competent. And why they don't feel that we are competent? This is not only in India. We have challenges globally. We have challenges globally, not only in India. Maybe India is very recent to have these courses. India is very recent to implement this course, or curriculums. But yes, we have these problems. We all have these problems, because we are somewhere lacking in the implementation of regulations. you know We are somewhere definitely lacking in implementing these regulations and objectives of our you know societies or our councils. Even in India, I'll tell you, pharmacy education in India traditionally has been industry and product oriented. In contrast to the situation in developed nations, graduate pharmacists prefer placement in the pharmaceutical industry. To practice as a pharmacist in India, one need to clear the diploma of pharmacy or with the 3 months of pharmacy practice studies. Okay. The pharmacy practice curriculum, I'll tell you, has not received much attention. In India itself, I'm telling you, there has been a surge in the number of institutions offering pharmacy degree. As you can see, the number of colleges, 2,740 colleges in India. And globally, they have good restrictions, I'll say, in Canada, in Australia, in USA, developed countries, of course. But these implementations and regulations, what you are seeing in the current slide, these I have taken from the ACPI, you know, American, College of Pharmacist, and their AHPI also, American College of Hospital Pharmacists, American Association of Hospital Pharmacists, AHP. They also feel that our curriculum needs the changes. The curriculum of the pharmacy education or pharmacy courses needs the changes to meet the market needs, to change the skill needs, because our students are lacking in the skill development. Because in colleges you can see that traditional approaches of teaching, our teachers are have not changed the slides. I mean, I should not say, but I have seen that, and my students also tell me that the teachers are teaching with the same slides for last 20 years, and this is true. So, and because there is no change in the syllabus every year, they also don't get any kind of changes in the syllabus. So they need to do it. They need to do it, and they don't get themselves updated to the current scenarios and the things. You can understand there are how frequently and how fast this profession is changing, how fast this profession is changing. You can see pharmaceutical care is changing. Clinical trials are coming with the new techniques, and with the multiple phases, and multiple new things are emerging into the pharmacy field. Drug development is coming up with many new things, drug development softwares, drug development techniques, and not only in pharmaceutical care one, and even in the industries are growing very fast. They are investing their money in the new techniques, and in the artificial intelligence, and multiple things. So these all emerging things needs to be incorporated in the curriculum, I feel, if not every year, at least on the frequent basis, to make it. You will be surprised, guys. You will be surprised, who all are listening to me. You will be surprised. In India, diploma of pharmacy, this 2-year course, have not been changed the curriculum for last 20 years. We had last updation in diploma of pharmacy course curriculum in 1991. I mean, I think for the 30 years, not 20 years, for the 30 years, they have not changed. So, and even in USA, and I was reading about Australia also, they have some problems in that. I mean, they also don't change it frequently. They keep it at least for 7-8 years or 10 years. And I think in this era, or in this current scenario, 10 years is too much, right? 10 years are really a long time to go with the one syllabus, where you can see we implement new techniques, we come up with the new pharmaceutical care process every year, or every new month we get something new, right? So these traditional approaches of teaching is one of the major challenge, and curriculum change, which has not been done for a long. must need our attention. And I think very, very important, factor or challenge what we all face globally is faculty recruitment and retention. First of all, the eligibilities and for different courses. As I was telling, when I joined the course, when I joined the PharmD, that time we did not have a single PharmD faculty. We did not have a single PharmD faculty. All were been from different phases of pharmacy practice, and these things, other course curriculums. Of course, we need some specialties, we need some people from different streams, but we need people, we need our mentors, someone who can actually understand the scenario, right? Pharmacy education in India is regulated by two organizations, if I tell you, which actually look over the faculty recruitment and in these things. One is Pharmacy Council of India, PCI, and then which was actually established under the Pharmacy Act of 1948, and other one is AICTE, All India Council of Technical Education. This faculty recruitment, I'll come to the faculty recruitment, why it is. Because the payment, insurances, and job assurance, these things are not fixed, not only in India, even in the developed countries. I'm reading many reports, and I'm going through the many papers, and that every third day, every second day, I hear and I read the reports like people are going for the strikes. People are in this university now, people are going for the strike on with the demands of salary, demands of their retention, demands of their promotion. And see, you must agree with me, that universities and their administration, they always update themselves, for their rankings. Like, they implement all the rules and regulations what they want to upgrade their rankings, right? But they don't update their faculties, they don't update their things. I really feel, because I have seen in last few years, even in India, faculties are forced to publish research paper if they're, even if they're not interested, right? And that forceful things leads them to the misinterpretations, and uh, kind of mischievous things and mischievous research, which is not actually needed and which can spoil our things, right? So that thing is there, which is not satisfying with the faculties, with the teachers, and uh, that is not even helpful in the retention of our faculties. And the third thing is assessment. What I'm telling is assessment is not correct anywhere. Assessment needs to be changed. Assessment needs multiple corrections, and not only based on the marks and based on the merits. You should look at the skill development programs. You should look at the other things as well. For an example, I'll tell you, being a pharmacist graduate, being a doctor of pharmacy graduate, we all need to understand all the pharmaceutical care facilities, all the pharmaceutical care techniques, all the pharmaceutical care processes. What we need to is, we need to understand the patient counseling, we need to understand the ADRs, we need to understand the drug interaction reporting, we need to understand the this adverse events reporting, as everything that comes under this. And we need to go through the prescriptions, how to go through the prescriptions exactly, and how to dispense the medications without error. Those things actually will not come with this ancient kind of curriculum or ancient kind of approaches. We need to definitely focus on the gradual things, focus on the new things. And nowadays, as we all are aware, that we, in last 2-3 years, we have shifted from that shifted to the technology part. So we need to understand the new softwares. We need to understand how to operate every single these micromedics and other services, other applications, and there are multiple things, right? So I'll say how to overcome this. There are great challenges expected ahead, even with the complex healthcare system of today and in the future. So we need pharmacy graduates with a special set of skills, knowledge, and competencies that fit the future needs and expectations. So what kind of things we need? I'll give one more example here. So after exiting Bachelor of Pharmacy or after exiting PharmD, everyone they do not choose to go to the pharmaceutical care only. They do not choose to go to the hospitals. They do not choose to the community pharmacy, going to the community pharmacy or dispensing pharmacy. Some people, they want to go to the industry. Some people, they want to go to the industry, and industry, they have multiple domains, like medical writing, pharmacovigilance, and HEOR, and we have data entry operators, we have softwares, we have data analysts, we have data management, big data management, we have clinical trials, we have CRAs. Many things are there. So these things are, I think, very new, because we check every year these guidelines are changed. Every year these clinical trial processes are changed. Every year the regulatory things are changed. So these things will come with their proper hands-on trainings, proper hands-on sessions in the colleges or outside the colleges. So those schools or pharmacy schools and all should connect with these courses properly. They should connect with this kind of skill development programs correctly, or they should conduct these programs in their colleges only. They should, I feel, incorporate these programs and these skill development things in their curriculum, right? And of course, we need effective, competent, and experienced leaders and educators in the education sector, definitely, because they are the pillars of our education system, because they teach the students. They only make them capable or make them competent to serve in this pharmacy world, right? I'll as I was telling, the numbers of schools in India, number of pharmacy colleges in India. For PharmD, I'll tell you one more scenario. There are only very few colleges, and this is not only in India, I'll tell you, because there are few colleges and few universities in USA also, in Australia also. There hospitals are not exactly, hospital services or clinical services are not exactly connected to their colleges. This is the major part of PharmD curriculum. This is the major part of any pharmacy curriculum, to get the students trained in the hospital for some time. And in pharmacy, it is for 2 years clerkship and 1 complete year for internship. But when your college is not attached to the hospital, or it is not nearby even to the hospital, few of my students, they called me a few days back. I mean, I used to discuss these things, challenges and the problems with the students, like what are they facing. So they got admitted in some hospital, and I got admitted in some pharmacy college, and now they got into their internship. So they were telling, sir, our hospital is around 35 kilometers from my college. For the clerkship, can you understand? First half of the day, they have to be in the college for their theory classes, and last half they have to go to the college, and they have to go to the hospital and practice the pharmacy, or to go to the hospital wards. So how is that possible? There are 3 to 4 hours in this 3 to 4 hours will go totally in the travel. And then how they will learn, what they will learn, and how they will come to that exact quality. I really don't understand. So these are the practical challenges what we exactly face in the pharmacy education, or in the pharmaceutical care, exactly in the pharmaceutical care education. So these things can be resolved only by the proper regulations, just not by opening multiple colleges, or just number of colleges, or number of colleges will not make the competent students, or competent professionals. We need to overcome these challenges. We need to overcome with their problems. We have to understand them, what exactly they want, and what exactly the profession needs. So I feel, I will end with this, that we need again leaders. We have who have divergent thinking and could lead in the present moment, to keep in the line with change in pharmacy, not in the old one. And they should understand the needs of people. We really need everyone has to face these challenges. And so this is definitely, I think everyone should come up, and everyone should tell their challenges, what they are facing in the real life, and we should come up with this. So yes, I have this much to talk right now, because I think I have exceeded time also, guys. Thank you very much for listening to me. And again, one more thing, COVID-19 has challenged us, and our education system has drastically changed in last 2 years. So we have to face new challenges. We have to understand the new norms as well to overcome. And because this has impacted the practice totally. We could not go everywhere in the world. We could not go to the hospitals. We could not see the practical scenarios. And much we all were involved in the COVID care. So we need to understand the new challenges as well. So this is my reference, and for the major things, this is the book written by John, and the book name is Pharmacy Education in the 21st Century and Beyond: Global Achievements and Challenges. So yes, guys, thank you very much for listening me patiently. Thank you.
Thank you so much, Ajit, for this nice presentation. Very insightful. I think it happened to all of us that we had the impression that during our studies, things were still taught the old way and had not been updated for many years. And I think all of us feel identified by that. And hopefully, of course, the current situation, I think one of the positive aspects will be that of course universities, schools had to reinvent themselves, had to find new ways of teaching, had to overlook their contents. I think there were subjects taught online that we never thought that could be taught online. So I think it's an interesting moment to be in. Quite insightful your presentation. So
thank you, Mario. Thank you.
As I met quite a lot of colleagues who are pharmacists or medical doctors in pharmaceutical industry. So myself, I'm a biotechnologist. So I think a lot of these people, as you mentioned before in your presentation, end up in industry because they do not find what they are looking for in the medical or the pharmaceutical profession. So do you have a view on that? So why do you think a lot of people end up in industry in the end?
Hello. Yes. So hello. Can you please repeat, Mario? Can you please repeat, Mario, once?
Yeah, I just wanted to, just out of the matter of curiosity, as we all in pharmaceutical industry have a lot of colleagues who are medical doctors, who are pharmacists. So why do you think a lot of people end up working for industry whilst they have chosen to work more like with a face to the public, being pharmacists, being medical doctors?
Yes, that is the thing, what I was discussing in my presentation as well. People who really want to serve, in the hospitals, in the, community medicines or community, pharmacy to the people. As I was telling, I was giving you example of my student. She has, joined the college, but she's now, feeling like, hospital people, they don't feel that she's competent to, talk to the patient. She's competent. She's not competent to, counsel the patient. So she's not satisfied with this job, so, and at the end we all have to think of the money and the mental satisfaction, and also they land up into the industry, because industry has lots of scopes in the medical writing, pharmacovigilance, and 9 to 5 sitting jobs. So they land up into the industry sometimes. That is the main thing, because and that comes from the old traditional part of teaching, or traditional part of training, because they are not actually trained in the new scenarios of pharmacy practice, or pharmaceutical care, or I'll say one thing, because pharmacists are actually meant to give even the vaccinations, to give the CPRs and all. But I will say, because I'm from India, I have seen the scenario here. I have seen many hospitals and many pharmacy colleges there. They do not learn about those skills. They do not learn about those skills, and hospitals and the pharmacy schools, they even they do not provide these things to the students, these skill trainings, skill development trainings, and that kind of things, what exactly students need to serve the community. They are not trained in that. So at the end, I really feel that they don't get that fizz to serve community, and they land up into the industry.
Interesting view on that. So thank you very much, Ajit. Very insightful presentation to learn about your ideas. And I think hopefully I think really we're at the turning point in education. So I think all of us are very much looking forward what it will be in the future. And for sure, I think in 1 or 2 years' time we will know more how this has impacted medical and pharmacist education. And then for sure would be good to have an update by yourself, to invite you again to see how this has been developed. So thank you very much for today's presentation.
Thank you very much.
And looking forward to see you around in our Pharmacircuit round of conferences.
Thank you very much. Do we have any questions?
I do not have further questions. I just checked from the chat that there were also not further questions on that for the moment.
No problem.
So I think we are all right, and so we thank you again for the nice presentation.
Thank you very much for inviting me, guys. Thank you very much.
Soon, Ajit.
Best wishes. Thank you. Take care.
Thank you.
Everyone.